Hi, I'm Natasha, your Care Management Nursepreneur. I'm a registered nurse, care management consultant, and I help nurses in primary care practices understand and implement technology supported care management models that actually improve patient health outcomes. In this video, I want to talk about whether care management is actually the right fit for you as a nurse. By the time nurses reach this point in the conversation, they usually understand what care management is. They understand that nurses can partner with primary care practices. They understand that this work is legitimate. But understanding something intellectually is very different from being ready for it personally. This video is about readiness. Skills matter, but mindset matters just as much. One of the biggest shifts in care management is trusting yourself. In traditional bedside nursing roles, we're often trained to wait for orders, to execute tasks, to follow instructions. Care management requires you to trust your assessment, your critical thinking, and your clinical skills. If you constantly second guess yourself or need validation for every decision, this role will feel uncomfortable at first. And that discomfort isn't a sign you're incapable, it's a sign you're growing. What is the biggest challenge I see nurses struggle with? Care management, especially when you're partnering with practices or building a business, requires visibility. You have to speak to providers, you have to explain what you do, you have to market your services. And for many nurses, marketing feels uncomfortable. It feels like bragging, it feels salesy, it feels unnatural. But marketing in this context is education, it's advocacy, it's clearly communicating the value of nursing. If the idea of introducing yourself, sending emails, or having conversations about your services makes you shut down, this is something you need to work through. I remember when I started, that was my biggest challenge. And after my first no, honestly, I stopped reaching out to providers. But after a few months, I decided that I would face my fear and do it despite feeling afraid. Most nurses were never taught that their license could be used beyond the bedside. We weren't taught how care is paid for, how services are structured, or how nursing works fits into the larger healthcare system. Care management exists because patients need support between visits, and primary care needs help managing complex patients with multiple chronic health conditions. To do this work well, you have to understand how care management actually functions inside a practice. That includes workflows, contracts that allow you to partner with primary care, documentation of your care management services, and the basics of how billing works. Learning these things makes you more effective. You have to be willing to learn. You don't wake up one day suddenly comfortable talking to providers, explaining CMS care management programs, or setting boundaries in your business. No one starts confident. You build confidence through repetition by actually doing the work. If you expect to feel fully ready before you start, you'll stay stuck. Care management rewards nurses who are willing to be uncomfortable long enough to grow. This work requires consistency. You're managing patient panels, you're following up, you're documenting, you're maintaining systems. There's no manager watching your every move. If you need constant external motivation or structure, you need to build that intentionally. This role gives freedom because it can be done remotely, but freedom requires discipline and consistently showing up for yourself and your business. This shift is about how you see yourself as a nurse, and it's deeper than most nurses expect. From the beginning of our careers, we're taught to attach our value to a role, a unit, a schedule, or an employer. We're taught how to function inside systems, but not how to see ourselves as independent professionals. Care management, especially when practiced outside of traditional bedside roles, asks you to separate your clinical competence from a job title. You're not becoming something new, you're recognizing what you already bring. You are not waiting for permission to use your nursing judgment, your experience, or your voice. That shift doesn't happen overnight. It takes time, reflection, repetition, and support. Care management is not an escape from burnout. It's a sustainable, long term role that aligns with value based care and the future of healthcare. If you're willing to build something stable, meaningful, and skill based, this just makes sense. Nurse care managers impact patient health outcomes. We prevent hospitalizations, we support chronic disease management, and we help patients navigate a system that often fails them. If that resonates with you, this work will feel purposeful. If this video helps you think, yes, this feels aligned, then your next step is education and structure. That might mean joining my school, Empower Care Academy, where I teach nurses how care management actually works in real world practice. It might mean reaching out if you're interested in mentorship and guided support. Care management isn't for every nurse, but for the nurse who's ready, it can be one of the most rewarding paths in healthcare. Thank you for watching. Please remember to subscribe to my channel for new videos, like, share, and leave a comment if you like this video.